We have the beautiful female pelvis here. So you have the front side, bladder, uterus with the fallopian tubes and the ovaries, and then the rectum back here, back up against the sacrum. So when we look at working the organs in this area, we can actually come in from the front. So this is the lower abdominal area. We can work the bladder, uterus, and rectum from the front here. We can also come from the space here in between the rectal opening and the vaginal opening, or come in through some of the musculature here to work on some of those organs. And then we can also come in from the backside to be able to get the backside of the rectum and a lot of the supporting ligaments to those areas. And so you can imagine if someone falls on their pelvis, so if there's an impact here, oftentimes to the tailbone, you can see how there can become tension in these pelvic organs, all of the nerves, all the blood vessels, surrounding areas. We've got the ligaments here on this backside that can get jarred and tight. And then you also have, sometimes we have a fall kind of to the side of our hip that can kind of throw things to one direction. And then also maybe contact sports or just chronic contraction of a lot of these muscles, we can get a lot of tension in the organs in this area. So you can actually have maybe a bladder that's shifted to one side and maybe the uterus followed over. So there might be this torsion between maybe the rectum to one side and then the bladder and the uterus to the other side. And so that can create a lot of force in the pelvis. So oftentimes that can present as urinary symptoms, bladder issues, PMS, hormone issues, difficulty getting pregnant, so fertility, and then it can also lead to some of the constipation, IBS, bloating, discomfort, that kind of stuff here. And so we've got some of that kind of typical presentation, but it can also present as, if this is considered here the SI joint, a lot of people have a chronic situation where one of these bones is rotated more than the other, or maybe shifted up more than the other. And so maybe people don't have specific organ type issues, but it presents as lower back pain on one side, or the need to constantly be, to get a chiropractic adjustment. Maybe it's leading into hip joint here, hip pain, hip dysfunction, mobility stuff that's not releasing in that area. And then it can also present as issues with the pubic bone, pubic pain, pelvic pain, and then up into the lumbar spine as well. So when we look at actually working and manipulating these organs, we are trying to follow the least path of tension, the path of least tension. And so how can we, if these again are shifted here and then the rectum is pushed that way, how can we connect with the bladder and see, does it want to be pulled to that side? Does it want to be guided back towards the side of tension and release on its own? Same thing with the uterus, the surrounding ligaments in here. And sometimes getting these to settle will then bring the rectum back as well. And so we're constantly reassessing, okay, what needs to be worked next? Once the tension around the organ system has opened up, we can check nerves, blood vessels down to this area. And then we also have to make sure that the bony structure and the surrounding muscles here, this is another area that we can access the bladder and work this area, but make sure the muscles in this area are working well. Again, how is the person bending over, squatting, breathing, all of that stuff. So very complex area, lots of cool ways that we can work to help the body really be in a better state to heal itself.